Greetings from Mombasa, colleagues. My name is Alan Maleche, the Executive Director of the Kenya Legal and Ethical Issues Network, popularly known as Kelin.
I'm coming from Zambia. I am a national coordinator for the Zambian Youth Platform.
Fortune Chibamba. I am the Acting Director General for the Zambia National AIDS Council.
Start with Mr. Zimba Isaac, coming from Zambia. I'm the National HIV AIDS Coordinator for the Zambia Police Service.
Nakate Florence Kakoza from the Uganda Police Force.
Is Dr. George Kainja. I am currently Commissioner of Police responsible for research, planning and reforms in the Malawi Police Service.
Bruce Tushabi is my name. I'm the Regional Training and Capacity Strengthening Lead for ARASA.
We are gathered here for the next 3 days to have an important regional conversation with law enforcement officers, healthcare workers from 10 African countries to discuss legal, ethical, and human rights issues relating to HIV and key and affected populations. We are keen to take this meeting to address what are the legal barriers, what are the human rights barriers, and what role can these two players, law enforcement officers and healthcare workers, play to ensure that the legal barriers are removed. This is a project that has been running since 2016, supported by the Global Fund through a regional grant hosted by UNDP. And this is the third regional meeting where we seek to achieve 3 things. One, we want to reflect on the last 3 years, what have been our successes, what have been the lessons we've learned, and what have been the challenges. And secondly, we want to see what are the synergies between the work of the law enforcement officers, the work of the healthcare workers, and the other projects dealing with lawyers, judges, parliamentarians, to be able to see how do we take this forward at a regional level, how do we take this forward at a national level to ensure that the gains made in this grant are not lost and that eventually it translates into changing the lives of key populations who are affected on the ground. And so we are looking forward to this conversation, and at the end of the 2 days we hope to have country work plans which will show how they will try to translate this work at the country level using existing funding from the Global Fund and other partners, but also to see what other synergies will be created here. We have about 80 participants, and also we have ensured that we have persons affected by HIV and TB in the room to meaningfully engage and share their experiences with a view. Join us in the conversation. We look forward to you being part of this conversation, and we shall keep you updated on the ongoing events.